Meet Audrey. Audrey had endured a series of pains over the past 3 years. Her life had been consumed by a cascade of unexplained bone fractures and agonizing generalized bone pains. Little did she realize that the root of all of her suffering was a substance she had been using for nearly a decade, a treatment she never told the doctors, using it to self-manage her chronic migraines. Join me in solving this pain mystery today. Each doctor Audrey consulted was as stunned as the last, unable to solve this puzzle of her deteriorating health. Audrey's medical history was as complex as her condition. This 47-year-old woman suffered from debilitating migraines, seizures, depression, and the constant torment of endometriosis. For nearly a decade, she retained a treatment that offered her one thing she desperately thought: relief from the chronic pain that shadowed her life. Yet, that was a secret she hadn't shared with anyone, not even her doctors. For almost 9 years, Audrey carried the seeds of her suffering. The treatment that once seemed like this salvation had slowly turned into its darkest effect creeping under the surface. Her bones, once strong and resilient, had been silently transformed. X-rays revealed a startling truth. Her skeleton was dense with diffuse osteosclerosis, a condition that rendered her bones brittle and vulnerable. As if that weren't enough, deposits of calcium had invaded her connective tissues, while her kidneys bore the scars of mild but undeniable damage. A lumbar CT scan of her spine from 2010 showed normal bone density and architecture. A thoracic and lumbar CT scan from 2023 showed diffuse osteosclerosis, a condition that shows abnormal bone hardening and increased bone density. Osteosclerosis of the spine can be caused by a variety of conditions like leukemia, infection, overactive thyroid, multiple myeloma, and intoxication by bisphosphonates, a medication used to treat osteoporosis. But to exclude any tumor or infection, the doctors ordered a bone scan with a radioactive material called technetium-99 M-hydroxydiphosphonate. There were no signs of cancer or infection, but there was a uniform uptake of all of her spine, arms, and legs. The term we use to describe this type of results is super scan. When we see a super scan, we suspect of metastasis of a bone cancer or a metabolic bone disease or a kidney problem. Then the x-rays of her arms, hands, legs, and feet were also ordered, and they showed very important clues for the definite diagnosis. A radiograph of her right forearm showed ossification of the interosseous membrane, which is a common feature of fluorosis, a condition caused by excessive intake of fluorine compounds, as those used by dentists to prevent cavities. The foot x-ray showed bone deposition and thickening at the junction of the trabecula lead to a sand-like granular pattern of the medullary cavity. She even underwent a bone biopsy. They removed a piece of bone from her thoracic spine to look under the microscope, and there was marked thickening of bone trabecula with hazard cement lines. The doctors were still puzzled and started treatment with zoledronic acid infusions for presumed Paget's disease, but this only made her bone pains much worse. They found some signs of a mild secondary hyperparathyroidism, but the doctors thought it was insufficient to cause such an impressive, marked diffuse osteosclerosis. Then, Audrey revealed that she had been using methoxyflurane for migraines and post-seizures muscle cramps in an attempt to avoid hospitalization and manage her chronic pain for 9 years. She lived in a remote area with limited healthcare access. She was advised to stop using this medication to self-treat her chronic migraines and muscle cramps, and she was referred to a pain specialist. Well, 1 month after cessation of her fluoride intake, she had a flare-up of her back pain, and there were 3 additional thoracic vertebral fractures. Methoxyflurane is a medication that has been banned from the US due to damage to the kidneys and liver. Outside the US, it's still used as an analgesic agent at lower doses for its rapid action and short-term pain relief, especially for anesthesia or paramedics in emergency situation. In Australia, where this patient lives, the prescription of methoxyflurane is limited to emergency department supply only. The doctor's bag, with a limit of 1 3 ml vials per month. Audrey was using methoxyflurane 9 ml per week for approximately 9 years. Fortunately, her kidneys and livers were spared. The bone abnormalities can be reversible with fluoride cessation, but it may take many months to normalize, and improvements in joint and bone pain is possible. This case highlights the critical importance of providing a full and accurate medication history, as withholding information from doctors can lead to serious and preventable harm. If you like this video, consider subscribing to this channel, and if you're interested in learning more about brain retraining techniques, check my courses on YouTube. Please remember that this video is not intended to provide medical advice, and if you have a painful condition that needs proper diagnosis, consult your doctor. If there is any emergency, call an ambulance or go to the nearest emergency department. This video is for educational purposes only. The cases presented in these pain medical mysteries are real. They were published in the scientific literature, and I just changed their names for a fictitious name. You can find the reference for this publication in the description of this video below. Thank you for watching today. Goodbye.